Good morning, everyone. We'd like to welcome you to our webinar this morning. Advocacy Links is pleased to be presenting on fall prevention in older adults this morning. Our presenter is Mary Bosch, and here's a little bit about Mary. I'm not going to read it verbatim, but she has been in this field for quite some time, and she presents frequently to social workers, families, nursing staff, EMS, and paramedics on how to prevent falls, communication and dementia care tips, happy holidays and dementia. She is a certified dementia practitioner, so she has a lot of experience in this field. So Mary, if you're ready, I'm going to go ahead and change it over to you.
Sounds great. Thank you. Hello, everyone.
And any questions you can type into the chat box, and we will discuss those at the end for Mary.
Okay, I'm trying to get this downloaded here.
You should just, wherever your PowerPoint is, it looks like down at the bottom, right next to your Microsoft Word there.
Okay.
To the right. There you go. You should be able to just open it and show it and good to go.
Okay. Okay. Is everyone ready?
Yep.
Okay. I am Mary Bosch, like she said. I'm a certified dementia practitioner, and I'm currently working at Golden Living Centers in Portage, Indiana, where we have rehab, we have long-term care, we have respite and memory care, and I believe you guys have respite, so if you ever have anybody that would need respite, we can take care of them here at a 24/7 facility with nursing and rehab staff here. Okay, so for our agenda today, we are going to talk about falls and how we don't talk to our doctors, or especially people with disabilities. They don't like to tell people that they have fallen, or they'll wait till they talk to the doctor and they don't even tell the doctor that they had fallen at some time. There's statistics causing of falls and how to prevent falls we'll talk about today. So here's just a kind of some older adults here that are talking. It says, I'll tell anyone I've fallen, I'll lose my independence. That's one of the biggest fears, is that if they tell them that they have fallen, they're going to think that someone's going to take their independence away. Or they'll say, I had a checkup to make sure I was well. So if I fell, then I was fine because the doctor said I was fine. And there's no reason why I fell. So I'm okay. And they said some of my medications were changed, so that's a usual thing that I had fallen, and that's not true. I was given advice on how to make my home safe. So my home is safe. So again, it's okay if I fell because my home is safe and there's no reason for it. I was given information about suitable exercise classes. They assume that if they take classes and they fall, it's all part of because maybe they took a class. So they're okay with that, and they don't want to tell people that they fall, especially, like I said, because they're worried about losing their independence. So every 18 seconds, an older adult is in the emergency room because of a fall, and they consider that 65 and older. In some persons with developmental disabilities, the degenerative changes seen in aging can occur as early as 35. Therefore, adults with intellectual disabilities and disabilities have an even greater risk of falls. So we have to watch that for our developmental disabilities and autism. Is at about age 35, their capacities of falling and their ability to fall is more likely. Every 20 minutes, an older adult dies from a fall in the United States, and they may be injured due to those falls. People with disabilities often are 4 to 6 more times more likely to fall because of their disabilities. Because many times they might have vision issues, they might have hearing issues. They also may have mobility issues that make them 4 to 6 times more likely to fall. So we always say, don't be the fall guy. 1 in every 3 adults age 65 and older experience a fall. 20 to 30% will have lacerations, hip fractures, head traumas, and some of these could be very severe. 2/3 more are likely to fall again, And in about half of all falls are due to the home environments that they live in. The most common injuries are spine injuries, hip fractures, forearm, legs, ankles, pelvis, upper arms, and even their hands. The risk factors, of course, are mobility issues that we had talked about due to muscle weakness. Maybe someone who has cerebral palsy, that's a big muscle weakness and issues. Balance issues, as someone gets older, the balance issues occur more often. Chronic health conditions such as arthritis and strokes may occur. Vision changes and vision loss, and loss of sensation in the feet. Sometimes if diabetes can cause neuropathy, and that could cause some issues with the feet. Inactivity, a lot of times as developmental disabilities and autistic and even elder adults, they have a tendency of not being so mobile. So as they always say, if you don't use it, you're going to lose it. And therefore, you might have more difficulty in walking and maybe getting up in and out of bed or a wheelchair. And those factors can cause that. So we always recommend definitely to do a lot more exercising. Wearing unsafe shoes. Everybody likes to wear their flip-flops. I had a lot of clients, back in the day, that always liked to wear their flip-flops, and what would happen most of the time? They would fall. So we always encourage nice, safe shoes, especially that have rubber bottoms, so that they preventing those falls. In the wintertime, of course, we recommend definitely rubber because you can fall and trip on ice or snow. Home environment is a big environmental factor. Lighting in homes is a huge environmental factor. Incorrect sizes for assistive devices like walkers and canes and wheelchairs and things like that. We always have to keep looking at those things, especially too. We have to protect them and make sure that the bolts are tight and things like that, especially wheels. There's been a lot of tendencies of wheels getting a little bit misadjusted because we have to make sure they're tightened. So we need to always make sure that our adaptive equipment is in good order. Wet floors are a huge factor. Fitness equipment is very big because if they do want to exercise, they need to understand how to use the equipment correctly. Pets, that's also a big issue. I know I have small pets and I have a tendency of getting in front of you. So we always recommend safety with pets and, to teach them about pets. Reducing chances of falling is reducing tripping hazards. That's a very big factor. And we can improve lighting. We'll talk a little bit about that more in a few other of the slides coming up. Preventing falls from injury. The problem with falls in healthcare facilities and in group homes is death and injury is very huge. 11,000 fatal falls occur in hospitals annually. A lot of times in hospitals, when they're there and you get a broken hip or fractured foot or something, sometimes I'll put on the door that they are a fall risk because they had already broken a bone. So hospitals are being more protective regarding letting everybody know that that person could be a fall risk. And they always, of course, recommend that you use your button to call for help if you needed to get up. There's $14,000 estimated average cost of a fall for an injury. I had a friend, interestingly, her son has a disability. He was 6 years old. He fell, and it cost $18,000 when he had a broken leg. So it is very costly when someone falls. Between 30 and 35% of patients who fall sustain an injury. So 6.3 additional days in hospital stays can occur because of that. Annual cost is $1 million for a 200-bed facility. Hospital, 400-bed facility is about $1.9 million. Annual cost to avoid those falls. Examples of targeted solutions, we'll talk a little bit about that in the next few slides. Causes of falls in the elderly adults. Environmental related accidents is 30.9%. Gait balance issues, that's 15%. Dizziness and vertigo, 13%. A lot of that can occur, especially as the population ages. Drop attack, that's 9%. Sometimes that could occur due to somebody having seizures, or sometimes too some behavioral issues can cause those drop attacks. Confusion is about 5%. If they have different medications that they've been on, that could cause some confusion. Also, too, if they're sick, that can cause some confusion. Or if you've moved into a different facility, that can cause confusion because they're unaware of their whereabouts and how to access their new homes. Postural hypertension. A lot of times if someone has hypertension and if somebody gets up too quickly, sometimes that could cause a fall because they might get dizzy. That's about a 5%. Visual disorders, that of course is, well, they're not even getting a statistic, but that's like a 1 or 2%. Syncope, that's dizziness, that's about 9%. And then other factors can be in effect, and that's about 15%. Don't fall and keep moving. We were talking about doing exercise. So it's safe to exercise and improve your muscle strength and tone. That's really important because that keeps your muscles strong. And like I said, with people with disabilities and as they age, they don't want to exercise as much. Even if they walk, that's understandable. So they may not have to do weights, but walking is a huge factor for people with disabilities and even dementia or even, elderly adults. It's very important. Even walking is important to, keep your muscle strength. Using proper shower chairs and walkers and wheelchairs in the homes is really important. Wear sturdy shoes. Do not slip. Have a thorough eye exam and hearing exam every year. That's recommended actually for everybody, but of course insurance is only covered every 2 years. But that's always important to check to make sure there's not any eye issues. Getting rid of clutter. We'll talk about that a little bit more. Go over all of the medications. That's a big, huge factor because a lot of medications can cause dizziness. They can cause falls because of the dizziness. So here's 10 fall prevention tips for seniors, and we do this also for developmental disabilities. Remove tripping hazards, such as books, papers, shoes, things like that. That's why we always tell them to keep their rooms clean, or we might have a day where they, they're going to have their room clean and put things away. And it's a big education factor to teach them those things because they have a tendency of like to throw things around. And that's important that we let them know that those can cause trips. Install grab bars in bathrooms and around toilets and things like that if you know that they're a fall risk. Also, to make sure that there's there's railings. Always too with railings, we always have to make sure that those are secure. Many times those will get unhooked from the walls. We have to always make sure to have those tightened. So those should be checked periodically because that could cause a fall going up a pair of stairs or going down a pair of stairs. Making sure that both the inside and outside lights is adequate. Make sure there's lighting in the hallways. Make sure there's appropriate lighting when they go into their rooms or kitchens. And especially going into a home, into their group homes, it's very important. Or their own family homes. It's very important to have the proper lighting. Check and repair any damages to walkways or steps regularly. That's another tripping hazard is because steps might have cracks in them or on the outside too. In the wintertime, of course, we have to make sure that it's well shoveled and well salted. Wearing sensible shoes, like we talked about. Have non-skid soles, especially with rubber, and to make sure they fit correctly. Proper vision is a major factor in falls. Getting an eye exam, like I said, at least yearly, sometimes, or if you need be because of insurance factors, every 2 years. Consider adding extra personal security by using a mobile alert systems or GPS systems in case that when they do fall, that they can press that button. And in that way, emergency alerts, especially if the ones that are in more of the intermittent villas, where there's only maybe 2 people in there, there's not as much staff help. Medication errors are a huge thing too. We always have to educate them and educate staff to let the doctors know of all their medication so that there's no interactions and make sure that when you do go, there's been issues with pharmacies not getting the correct medications. Staying active, that's a huge factor. Like I said, exercising to keep those muscles moving. Fall proofing for aging adults and disabilities. One of the biggest things, of course, is in the shower or in the, in the bathroom. That's a huge factor. We always have to make sure that we have, especially in the tubs, that there's non-slip in the tub. We don't want to have like those little plastic ones that kind of lay in there because those, even though you tack them down, they can come off. So we don't recommend that they have the suction cups in the tub. We recommend that there's non-slip in those tubs. Also, too, in the kitchen, make sure that they're able to, after maybe someone's if somebody has cleaned the kitchen, make sure that they don't go in there. Or if they clean their rooms, if they, have tile floors or if they have wood floors, make sure after they're cleaned that they wait until it's dried. In living rooms or even in the bedrooms, make sure the cords aren't in front of a chair or in front of their bed so that it's not a tripping hazard. Make sure they're behind all those things so that they don't trip. So here's a little example here of some issues in a home. Anybody can tell what are some of those issues in that home? What can you see in this picture that's showing you that there's some issues? Anybody?
They're all muted.
They're all muted. Okay. All
let
right.
me
Well,
see. I've got
about that. If you can see, there's someone walking down the stairs, and there is a bunch of boxes. It looks like books on there. That's definitely a tripping hazard. And it looks even that stairs does not even have a railing. That's not safe either. We got to make sure we have railings up. Also, too, looks like the cat's playing around with those cords. So we definitely know that those cords should be more secure. The lady there too, she's sitting down and right in front of her is a rug. That's a huge tripping factor, are rugs. It's always recommended if someone has fall issues that we don't have rugs sitting around. That's definitely a no-no, as the doctors and all the healthcare professionals would tell you. There's an issue there. It looks like the medications are in the cabinet. That could be a fault because there looks like there's a table right by that cabinet. You can't have things next to each other like that. That's all tripping hazards. All right, this is a really quick seminar, just kind of give you a little synopsis. Are there any questions?
We haven't had any come in just yet, but please feel free if you have any questions to type them into the chat box, and I will make sure that they are read. Okay, I'm not seeing any come in.
Okay, sounds great. If anyone ever has any questions, my number, you guys can let me know. My number is 708-785-2249, and I'm always more than willing to do assessments on homes regarding fall risks and things like that. I've done a lot of assessments. So if anyone's interested in that, maybe to talk with families or anything like that, I'd be more than happy.
Excellent. All right. Well, just some general housekeeping. For those of you who are on today's webinar, you will receive an email thanking you for your attendance, and that is your verification that you did attend. And that can be used if your particular company is willing to give you credit for today's training. We did have somebody ask, where are Golden Living Centers located?
There actually is 23 Golden Living Centers in the state of Indiana. They're in Northwest Indiana. There's like one in Valparaiso, Maryville. I'm in Portage. We have 3 in the South Bend area, and in most of the other ones are further down near the Indianapolis area.
Okay.
And if you'd like, if anyone's interested, I can get actually a list for them if they'd like. I can give you my email address if you want to email to them, and if anyone's interested in a list, I'd be more than happy to give them a list of all our Golden Living Centers in the state of Indiana.
What is your email, Mary? I'll put it in the chat box here.
Capital MARY dot BOSCH at goldenlivingcenters.com. And like I said, for the developmental disability waiver, we would take, like if an individual had respite hours, we would more than happy take it at any of our facilities for them to come here. They'll get 3 meals a day. They would have, 24/7 staff. They would have nursing to make sure that they get their medications. And of course, they'd be able to join in all the activities that we have.
Great. Okay. All righty. Well, we haven't had any other questions come rolling in, and we don't want to take up more of your day. We
Great.
appreciate your time this morning, and thank you so much for the great information.
Okay, sounds great. Thank you, everyone.
All right. Have a good day, everybody.
Okay, you too.
Goodbye.